Hi, I'm Manny Friedman. I've been practicing dentistry for 41 years and limited my practice to endodontics for the last 17 years. I've also been teaching almost that long. One of the most critical aspects of endodontics is the final restoration. If there is insufficient tooth structure to provide adequate retention for the crown, a post and core is essential. I would like to take a couple of minutes to walk through the steps I use when placing a post and core. But before I start, I make sure I have the right tools. Here are a few things I incorporate into my technique. This first image shows needle tubes of varying diameters, which will be used to both wash and dry the post space. We will also use them to extrude resin material into the post space and build up the core. The next image is a Stropco irrigator with a needle tube already attached. The Stropco is fitted to your regular air-water syringe. These are fiber micro brushes. They are used to clean the post space and apply dentine bond resin to the etched post space. Here you are looking at a micro syringe. This is what I like to use to inject the resin into the post space and build up the core. I like this syringe as the yellow color prevents light from prematurely setting the dual cure core material. When creating the post space, we all have our favorite drills. Let's focus our attention here on how to approach this when the canal has been filled with a carrier-based obturator. For these, you will want to use the Pro Post or GT Post drill. These feature a unique eccentric tip. This offset tip will remove either a plastic carrier or regular gutta percha. Regardless of the system you use to remove the gutta percha, you should always engineer the final post hole to match the post system you will be using. So let's get started. You'll want to start with a clean post space. Rinse the area thoroughly with water using the Stropco irrigator and an appropriately sized needle tube. I find the 20 or 22 gauge needle to be the best for me. The next step is to dry the post space, again using the needle tube attached to the Stropco. Etching the space is next. It is important to do this to get the best possible bond between our cement and the root structure. Place the etch in the canals and in the pulp chamber. Use a needle that will be small enough to penetrate to the end of the post space. Always inject the acid from the apex to the coronal aspect to avoid air bubbles. Fill the coronal chamber and let the etch sit for 15 seconds. I always agitate the acid in the canal with a small microfiber brush to ensure the canal gets really clean. In the coronal pulp chamber, I use a larger microfiber brush. However, in very large canals, you can use a Versa brush. This image shows us using the Versa brush to clean a large canal prior to cementing the post. Rinse the acid from the canal space and the pulp chamber. Again, you'll be using a needle tube attached to the Stropco. Wash the space well to remove all signs of acid and gently dry the canal space and the coronal pulp chamber. Be careful not to desiccate the dentine. Apply the dentine bonding agent to the post space and coronal dentine, again using the appropriate resin brush. Air thin the dentine bonding agent, and you will need to do this to ensure there are no pools of the bonding agent in the canal or pulp chamber. Next, we will light cure the bonding agent. Let me add a couple of notes as we prepare for cementation. Make sure to attach the appropriately sized needle tube to the brown syringe. I like one known as the skinny, which I showed you earlier. Screw it down tightly and fill your skinny about 3/4 full with your dual cure core resin. I like Cosmocore, but whatever you choose, make sure you've selected a material that gives you adequate working time and has a viscosity that can be extruded through these small needle tubes we work with. I find that Cosmocore, when used with the yellow filter either on the microscope or on a headlamp gives me about 3 to 5 minutes of working time. As I mentioned earlier, you will still want to make sure you insert the needle tube to the bottom of the post space. Again, make sure you inject from the base to the coronal aspect, stopping at the orifice. Gently insert the posts into their respective canals. Because we are using post size to our drills, we know that we are going to have a passive fit and the post will seat readily. Do not waste time. Remember, if you are working with unfiltered overhead light, your working time is significantly reduced. Cure the first increment of resin and incrementally extrude the remaining resin around the post, curing each increment for about 20 seconds until the core is complete. When the build-up is complete, trim the excess core material and adjust the bite. Of course, every case is different and you'll occasionally get some odd-shaped canals. Let's take a look at an example. This first image shows us an odd-shaped canal in an upper lateral incisor tooth in which I placed 2 posts, a primary and an accessory post. Here you see them both in place. This image shows the completed core build-up adjusted for the occlusion. Posts are not recommended for every tooth. When they are appropriate, these simple steps should help you towards a great restoration. I'm Manny Friedman for Chair Time.